All right, dear students, you are welcome to this session. We shall be looking at nursing process. By name called Kiden Robin, and I'll be taking you through this session, guiding nursing actions for holistic patient and patient care centered. Like previously we said, that you may have 2 to 3 people suffering from malaria, but they will respond differently. Their bodies will respond differently to the infection. Others will have diarrhea, others severe headache, others will have abdominal pain. So the nursing care that we give to these patients is determined by how their bodies have responded to the infection. And that's why we call it a patient-centered care. So the importance, it involves scientific reasoning and critical thinking for optional uh, client care. So when using nursing process, you need to always reason and think critically. You should be able to identify the problem, then get a solution to that specific problem. Like you're nursing someone, uh, if you have been giving the patient medication, you should know that there are some medications that have side effects. So, as a nurse, if you are nursing someone and the person has a severe side effects, there are chances that you may need to withhold the treatment and inform the doctor immediately. So, such critical thinking is very, very important to us. It's not a matter of doing what the doctor has instructed us to do, like, for instance, administering medication, and you only concentrate on doing that. So it involves thinking outside the box. So purpose of the nursing process, the purpose is to identify clients' health status and needs, that is assessment, establish plans to meet identified needs, deliver nursing interventions, that is through diagnosis, planning, and implementation, then apply evidence-based care for health and illness, legal protection for nurses adhering to standards. If you do your nursing care up to the standard, in case they sue you to court, you can use the documents that you have, the documentation that you have used, the nursing care plan that you have used. It can be able to bail you out. For instance, if they charge you of patient negligence, but you were able to document each and everything that you did to the patient, and there was a third party who observed when you were doing these procedures, then you will be able to be free because you have actually followed the right procedures. Then, systematic practice organization. So, the care that we give when we use the nursing process is the systematic, following a certain kind of order. Then, create a client a health database that we can be able to refer to in case we need more information about the care that we are giving to the patient. So the first characteristic is the nursing process is patient-centered. It uses patient-centered approach. It is respectful, responsive care tailored to patient's needs. What the patient needs is what we act on. We don't say that these patients are all suffering from malaria, so we give the same kind of care. No, because their bodies respond differently. So that's why it is patient centered. The patient, the character, the features that you have observed on the patient determine how you are going to care for him or her. Then a nurse also acts as the advocate in this case for informed decision making. This means that you educate the patient on what is right and what is wrong. Then the patient can also decide on what he thinks is the right thing to be are done. Then we also talk on behalf of the patient as far as nursing process is concerned, more so concerning the care given to the patient. Then interpersonal interaction, therapeutic nurse-patient relationship. So we have that in nurse-patient relationship, which is purposive, and it is targeting the care that we give to the patient. Other than that, there is no any other. We don't develop this casual kind of relationship, but what we do and the interaction for both. So during the nursing process, we also have that future of learning and growth. We learn from the patient, and the patient also learns from us. Then collaborative teamwork, nursing and the interperson and interprofessional collaboration, shared communication and decision making. So we don't do all the care that we give to the patient cannot be done by the nurse who is on duty alone. So it is a shared responsibility. We collaborate with the other disciplines, like for instance, physiotherapy, dietitians, and many others, because we need to consult from them. As a continuation, dynamic and cyclical nature. So phases interact and influence each other. You cannot go to the second phase when you have not finished the first. You cannot diagnose when you have not assessed the patient. So the first step comes first, then the second also follows like that. Then it is cyclical, it is dynamic and cyclical in such a way that with time, you need to go back to the first step, then again follow all the phases like that. Critical thinking requirements. So this nursing process requires critical thinking in everything that we do. Like I mentioned before, you should be able to identify the problem and get the right solution to it. Nursing process steps, there are 5 steps. That is assessment, diagnosis, planning, implementation, and evaluation. So this you can abbreviate them in the mnemonic of ADP, IE. So iterative process, the nursing process has phases that overlap and continue. So the first phase, which is assessment, has involves collection, organization, validation, documentation of clients' health status, and under this physical examination and observation, which we shall look into details. So right there, there's a pictorial that is showing a nurse interacting with a client, the nurse is trying to assess the client. Types of data. We have objective data. The objective data is basically the measurable and tangible information. So this normally we get it through the assessments as the health workers. When you take the vital signs of the patient, do physical measurements, then observations, you're able to obtain this data. Then subjective data. This is a kind of data that you will get from the patient. These are inner thoughts that the patient herself tells us. If we don't hear from the patient, if the patient does not tell us, we cannot know what exactly is happening. Then we have verbal and non-verbal data. So the verbal data is the spoken or the written information. Then under it also we have statements, tone, and assertiveness. The statement that the patient makes, the tone through which the patient makes uh, these statements. For instance, you ask the patient, "How are you feeling today?" Then the patient tells you, "I'm feeling okay," but you feel that the tone that the patient is using does not actually mean what she is saying. So those are some of the observations that a nurse can make. Then assertiveness, the strength through which, or the confidence through which the patient says something. determines whether it is really realistic or not. Then in non-verbal data, uh, this one is observable behaviors without words, body language, gestures, and the facial expressions. So this we see how the patient is behaving. The patient tells you that she's okay, she's not having any pain, but you see she's frowning her face. So that facial expression shows a lot of things.